Okay, this is a book review. The books are Hippocrazy and Surgery, The Ultimate Placebo by Ian Harris. Ian Harris is an orthopedic surgeon, and he's also a researcher, and he came to the conclusion that a lot of surgeries are highly overrated, and he tried to figure out why. Why is surgery so overrated? Now, don't get me wrong, surgery is great for some things. It'll save your life. It'll really help you. But for a lot of stuff, it's quite overrated. And this is something Jeff Nelson came up with, this hype and bust cycle of industry-funded research, especially for, new foods and supplements and some new drugs. But basically, when the thing first comes out, all this positive publicity saying how wonderful this new herbal tea is, this new coffee, and you'll hear the same thing for other stuff. You've heard it for nuts, for flax, for soy, and then it comes along for orthopedic surgeries, for coronary artery stents, etc. And then it'll get a different type of halo. Like the food will initially get what you can call a green halo. The yellow halo is the health halo. A little bit of time goes by, a couple years, could be 3 years, 5 years, 10 years, sometimes it's 15 years, and people start to see, well, gee, it really doesn't work that well. It doesn't seem to make much of a difference. And then when more time goes by, then you will see that it actually is damaging, okay? Like, omega-3s. People start to realize they don't make much difference, and then they study them some more. They realize omega-3s, they increase your risk of, atrial fibrillation, immune suppression, etc. Okay, so this is pretty typical. So what I'm also saying here is you don't want to be an early adapter with medical stuff. Very, very rare would you want to be an early adapter because almost everything comes out exaggerated. Another classic example would be like Prozac, the selective serotonin reuptake inhibitor antidepressant drug. At first it came out as, God's gift to treatment of mental health problems. Then it turns out it causes brain damage, it increases suicide risk. It's bad. It's real bad. Now they even talk about using it potentially for chemotherapy. Okay, so it's like the opposite of what they said it was when it first came out. So anyways, the hype and bust cycle, be aware of this because this is the most common thing that happens when new foods and new supplements and new drugs are introduced, is that they don't pan out to be as good as they were promised. Initially there's all this industry-funded hype to sell them. Okay, so now we're going to get into the book more. Okay, so he's an orthopedic surgeon and researcher. There was a co-author on the second one, Rachel Bookbinder. She was like a rheumatologist, and she saw the same thing, is that real research that criticizes a surgical procedure or a drug or something gets, the companies will fight back and try to demonize the researchers. So nobody wants to publish negative stuff because they can go after you. If they got a lot of money, they can try to, get you defunded all your research. So somebody who wants to do research for a living, they don't want to piss off the big corporations. Okay, the surgery placebo was written in 2016. Hippocrazy was written, actually, I think it was 2021. Ian Harris says the benefits of surgery are often overestimated because of a placebo effect. The total perceived therapeutic effect is a combination of the real therapeutic effect, what really happened, versus how a patient perceives it. He says the public totally overrates things. I noticed, like for robotic surgery, like a typical scene was I had this one guy, he said, he's going to go to university. I'm not even going to say the university name. Big fancy university hospital, kind of like the Harvard of the Midwest, let's call it. And I'm like, I don't know, I don't think I would do that. But he ignored me because he knew better. Okay, he went and had prostate surgery with a new robotic surgical device. They lacerated his colon and spilled stool all over his abdomen. He ended up having 7 different abdominal abscesses, a big disaster. What I'm trying to say is, to a patient, robots, lasers, that sounds cool. To me, I'm like, what kind of dexterity does a robot have? Okay, I'm not, that would scare the crap out of me, the idea of a robot doing my surgery, okay? Stupid. Voltaire had said, the doctor amuses the patient while nature cures the disease. Yeah, lots of stuff gets better. You just give it some time to heal on its own. A lot of back pains like that. Lots of diseases. A lot of arthritis. A lot of aches and pains are like that. Lots of surgeries are accepted on very little data. There's no randomized controlled trial of these things. They're just plausible mechanism, seems reasonable, let's start doing it. And they'll be based on a bogus surgical therapy, like the theory of centripetal spread. leading to all these radical mastectomies, you know. It's a pretty brutal, big surgery when you get the same results. Now it's known from lumpectomy. They should have been testing it out with these more milder surgeries from the beginning. Okay, it depends on how you judge results, that you can get very different assessments of a surgery. He says, for example, if you look at knee replacement surgery, the surgeon will look at the technical result. You know, does the joint bear weight? Is the prosthesis able to stay in at 5 years? Only 5% need a revision to be taken out. But the patient point of view is, you know, how many of them have pain? How many are functional? And about 17% at 2 years post-op are unhappy with the results. Okay, so the surgeon is giving you, you know, 3 times better, more than triple better results than what the patient will say. So he says it depends how you judge the results, and he thinks it's more important to judge by what the patient says. They're the one that have to live with the outcome. Overall, surgeons tend to rate the results of their procedures significantly better than patients do, because they're going by how does it look on an x-ray or a CAT scan, and the patient's going by how do I feel, what can I do, what's my disability level compared to before the surgery. Okay, like spine surgery is a good example. Spinal fusion surgery with the posterior instrumented fusion, pedicle screw fusion. The surgeon's looking at it, where was I able to achieve successful fusion of the bones, whereas the patient's like, does my back hurt less? Can I do more stuff? Can I still do the same stuff I used to? Okay. Because there's always a trade-off. When you do spine surgery, you got to cut through the muscles of the back, and that's going to cause some stiffness of the back and decreased strength. Okay, big-name doctors from big-name medical centers, they're often paid a lot of money by drug companies, device manufacturing companies to promote the new surgical device, to promote the new drug. So you can't trust them. They do it all the time. They overhype stuff. It's just the standard way it goes. I'm always real suspicious of anything that just came out within the last 10 years. You know, after 10, 15 years, usually you know, but it can take 15 years. Enthusiasm for a new technique is often, you know, irrational exuberance, you know, like they used to say about the stock market. And the procedure gets done way too much. They start using it for a variety of other implications, indications that weren't originally the deal, and the complications start piling up. And then somebody says, oh, the emperor has new clothes. We got to back off on this. And that whole process of everything right there usually takes 10, 15, 20 years. Examples of overrated interventional and surgical procedures that were discussed in the book included. And by the way, he discussed about 5 times as many, but here's just a couple quick ones that come to mind. Metal on metal hip replacements, not a good idea. Patent foramen ovale closure for migraine headaches, totally overrated. Knee arthroscopy for DJD, overrated. Spinal fusion surgery, radical mastectomy, lobotomies, ECA to MCA intracranial bypass, so external carotid artery to middle cerebral artery bypass surgery for treatment of cerebral vascular disease, coronary artery stenting, mammography. So anyways, the point I was going to say is if you are considering going for surgery, you want to learn about that surgery a lot. What is the real outcomes from a patient point of view before you agree to it? And then ask yourself the question, you know, like let's say you got arthritis. Can I improve my arthritis symptoms and function by going low-fat vegan? Why not do that first, filtering your water, avoiding other toxins? Fix it as much as you can on your own, diet and lifestyle. And if you still can't get an adequate result, maybe you need surgery, okay? But you don't just jump to surgery. Because in my experience, patients, they really want, oh, my back's killing me, my back hurts so much, I just got to get it fixed, I got to get it fixed. And they think it's like 1 + 1 = 2. No, you look at an MRI, and very often you don't even know what's really causing the patient's pain. And you do a surgery or something, you're just hoping it'll work. You don't know if it's going to work. So then they're often disappointed. And what I'm saying is, if they had done all the other stuff first, improved the blood supply by eating a low-fat, low-sodium diet, optimize their body weight, minimize systemic inflammation, avoid all the toxins in personal care products, filtering their water, etc., maybe they'd have a dramatic result. And, you know, maybe they wouldn't need anything more. Maybe they would, maybe they wouldn't. But why not try that first before you rush into something that's irreversible? Anyways, I hope you found that helpful.